Right now, as you are watching this video, somewhere in the world, a person is having a heart attack. In fact, every single 40 seconds, an American suffers a cardiac event. And here is the terrifying part. Many of them had no idea it was coming. Or worse, they had every warning sign imaginable and they dismissed it. They waited. They told themselves it was probably nothing. And for some of them, that decision cost them their lives. I am Dr. Robert M. Rose, and in my years of practicing cardiology, I have sat across from far too many patients and far too many grieving families who said the same thing. I wish I had known. Today, that changes. Today, I am going to walk you through the 5 warning signs of a heart attack that you should never, under any circumstances, ignore. These are not obscure medical facts buried in a journal.
These are real signals your body sends you, sometimes weeks before a major cardiac event. And most people either don't recognize them or they push them aside because life is busy and the signs don't always feel like what you see in the movies. Because here's the truth, and I need you to hear this clearly. A heart attack does not always announce itself with a dramatic clutching of the chest and a fall to the floor. Sometimes it whispers. Sometimes it disguises itself as indigestion, as fatigue, as a pulled muscle. And that disguise is exactly what makes it so deadly. So let's get into it. The first warning sign is chest discomfort. And I want to be very precise about how I describe this because the word discomfort is intentional. Most people wait for pain. They wait for something sharp, something stabbing, something that screams emergency. But cardiac chest discomfort is often none of those things. Patients describe it as pressure, a heaviness,
a squeezing sensation, like someone has placed a large hand across the center of their chest and is slowly tightening their grip. Others describe it as a fullness, almost like they have overeaten, or a tightening that comes and goes over several minutes. This discomfort typically lasts more than a few minutes. It may fade and return. It may be mild enough that you convince yourself it is nothing. I have had patients tell me they waited 4 hours before calling for help because the discomfort was uncomfortable but not unbearable. 4 hours. By the time they arrived at the hospital, significant damage had already been done to the heart muscle, damage that is largely irreversible. So if you feel any unexplained pressure, squeezing, fullness, or tightness in the center of your chest that lasts longer than a few minutes and cannot be explained by something you just did physically, you treat it as an emergency until proven otherwise. That is not overreacting. That is being smart about your survival. The second warning sign is one that confuses people more than almost anything else, and that is pain or discomfort that radiates. The heart is a remarkable organ, but the nerve pathways that carry its pain signals to your brain are shared with other parts of your body. This is why during a heart attack, you can feel significant pain in areas that seem completely disconnected from your heart. The left arm is the classic example, and yes, that one is real and it happens. But the pain can also radiate into the right arm. It can travel up into the jaw, the neck, or the upper back. Some patients come in describing what feels like a severe toothache with no dental cause. Others feel an aching across both shoulders. What makes this warning sign especially dangerous is that it often occurs without any chest discomfort at all, particularly in women. Research has consistently shown that women experience atypical heart attack symptoms far more frequently than men. A woman may never feel anything in her chest. She may only feel jaw pain or unusual back pain or pain in her upper abdomen. Because these symptoms do not match the stereotypical heart attack image, they are frequently dismissed, sometimes even by medical professionals. I want every person watching this, regardless of gender, to understand. Unexplained pain that radiates through the upper body, jaw, neck, shoulder, arm, upper back, especially when it accompanies any other symptoms on this list, demands immediate medical attention. The third warning sign is shortness of breath. And I am not talking about the breathlessness you feel after climbing 3 flights of stairs when you have been sedentary for 6 months. I am talking about shortness of breath that comes seemingly out of nowhere. You are sitting still. You are resting. You wake up in the middle of the night and find yourself struggling to catch your breath. You have a simple conversation and feel oddly winded in a way that makes no sense given your activity level. This happens because when the heart begins to struggle, it cannot pump blood efficiently. Fluid can begin to back up into the lungs. The lungs, now partially compromised, have trouble doing their job, which is, of course, getting oxygen into your bloodstream. This creates a sensation of breathlessness that can precede a heart attack by days or even weeks. It can appear alone or in combination with chest discomfort. In many patients, the shortness of breath actually comes before the chest pain. If you find yourself becoming short of breath during activities that have never caused you to struggle before, or if you experience it at rest without any clear explanation, please do not brush it off. Your body is sending you a signal. Listen to it. The fourth warning sign is one of the most underestimated, and that is extreme, unexplained fatigue. Now, I understand that fatigue is one of the most common complaints in the world. Everyone is tired. Life is exhausting. But the fatigue that can precede a heart attack is different in quality and intensity from ordinary tiredness. Patients describe feeling as though they are carrying enormous weight, as though every task requires monumental effort. One patient told me that in the 2 weeks before her heart attack, she felt so exhausted that making her bed in the morning left her needing to sit down and rest. She was in her mid-50s. She was not someone who had ever experienced that kind of fatigue before. This extreme fatigue occurs because the heart, when it is not functioning properly, forces the rest of the body to work harder to compensate. Your muscles are getting less oxygenated blood. Your organs are working under strain. Your entire system is under stress, and your body expresses that stress through profound, unusual exhaustion. This is especially common in women, and it is one of the reasons that heart attacks in women are diagnosed later and treated less aggressively. The symptoms simply do not fit the template that both patients and sometimes clinicians expect. So if you or someone you love is experiencing fatigue that is dramatically different from their normal baseline, fatigue that seems disproportionate to any physical activity or lack of sleep, that deserves a conversation with a physician. Not next month, not next week, soon. The fifth warning sign is a combination that I call the cold sweat cluster, and it includes cold sweats, nausea, and lightheadedness. These 3 symptoms frequently appear together in the lead up to or during a cardiac event, and each of them is the result of your body's emergency response system being activated. When the heart is under serious stress, the sympathetic nervous system kicks into high gear. This is the same system that governs your fight or flight response. It diverts blood away from the skin, causing that cold, clammy sweat even when you are not physically hot. It slows digestion and can trigger nausea or even vomiting. And it can cause a drop in blood pressure that makes you feel dizzy, lightheaded, or as though you are about to faint. Individually, any one of these symptoms can have a dozen innocent explanations. But when they appear together, especially in combination with any of the other warning signs I have described, the picture changes entirely. I cannot count how many patients have come in describing what they were certain was a stomach bug or food poisoning, and it turned out their heart was the problem all along. The nausea threw them off the trail. The sweating seemed like a fever. They waited. And again, that waiting is what causes so much preventable damage. Now, I want to address something directly because I know how many of you think, and I know this because I see it every single day in my practice. You are going to watch this video, you are going to feel informed, and then the next time something feels slightly off, you are going to talk yourself out of taking action. You are going to say, I am too young for this. You are going to say, it is probably stress. You are going to say, I do not want to bother anyone. Or, I will feel embarrassed if it turns out to be nothing. So let me be unambiguous with you right now. There is no such thing as being too young for a cardiac event. Heart attacks in people under 40 are rising. They are rising in women. They are rising in people with no prior history of heart disease. Stress, poor diet, sedentary lifestyles, sleep deprivation, and uncontrolled blood pressure are creating a generation of cardiac patients that no one expected. Age is not a shield. And as for embarrassment, let me tell you what actually happens in an emergency room when someone comes in and it turns out to be nothing serious. We call that a good outcome. We send you home relieved, maybe slightly embarrassed, and very much alive. Compare that to the alternative. There is no competition. No physician worth their degree will ever make you feel foolish for taking your chest pain seriously. The only foolish thing is not coming in. If you experience any combination of the symptoms I have described today, chest pressure or discomfort, radiating pain in the arm, jaw, neck, or back, unexplained shortness of breath, extreme and unusual fatigue, or the cold sweat cluster of nausea, sweating, and lightheadedness, call emergency services immediately. Do not drive yourself to the hospital. Do not wait to see if it gets better on its own. Call for help, sit or lie down, and if you have aspirin available and are not allergic to it, chew, not swallow, one adult aspirin while you wait. Chewing it allows it to enter the bloodstream faster, and aspirin helps prevent further clot formation. This simple act can make a meaningful difference in outcomes. I also want to speak for a moment to those of you who have loved ones, parents, spouses, siblings, friends, who you know are at risk. People who smoke, people who are overweight, people with diabetes or high blood pressure, people who have a family history of heart disease. These individuals are statistically less likely to act on their own symptoms. The cultural messaging around toughness, the fear of being a burden, the reluctance to acknowledge vulnerability, all of these things cause delays that cost lives. Make it your responsibility to know these signs. Make it your business to have this conversation with the people you love. Tell them what you learned today. It could be the most important thing you ever do for them. Heart disease remains the #1 killer of both men and women in the United States. Not cancer, not car accidents, not any of the things we tend to fear most. Heart disease. And the agonizing reality is that so many of those deaths are preventable. Not through some expensive treatment or cutting-edge technology, but through awareness, through education, through the simple act of recognizing a warning sign and choosing to take it seriously. Your heart has been working for you every single second of your life without rest, without complaint, without ever asking for anything in return. It beats approximately 100,000 times per day. It pumps roughly 2,000 gallons of blood through your body every 24 hours. It has never taken a day off. The very least you can do, the absolute minimum you owe that incredible organ, is to pay attention when it is struggling to tell you something is wrong. I am Dr. Robert M. Rose, and today's message is simple. Know these 5 warning signs, take them seriously, act fast, and please share this video with someone you care about. Because the next person whose life gets saved by this information might be someone sitting right next to you. Thank you for watching, and take care of your heart, because it is the only one you have got.